Greetings, doctors. My name is Mahmoud Abada. I studied medicine in Egypt and I passed my NAC exam in 2022. I would like in this video to try to provide some helpful tips and advice to future NAC exam candidates on what to expect, the structure of the exam, how to prepare, and how to improve your performance on the exam. And I will use a myalgia case scenario as an example. The NAC exam consists of 12 stations where you spend 2 minutes reading a case introduction and 10 minutes with the patient and the examiner. During the station, an alarm buzzer will sound only once at the 7 minutes mark, at which, and according to the station type, you can either continue interacting with the patient or start interacting with the examiner if he have any questions for you. A good study material source is very important and can make a huge difference on how well you are prepared for the exam. I can recommend two which I found to be very beneficial. There were, first, NAC OSCE, a comprehensive review, and second, Canadian IMG's Guide to OSCE and Practice. It's essential to practice your skills in a study group, preferably with other healthcare professionals. But if that cannot be managed, you should still try to set a practice session with a family member or a friend. It's very important to know and have a feeling or an internal clock, if you will, for what you can do in a 7 to 10 minutes time frame, as you are not allowed to keep your watch with you and there is no timer in the examination room. There can be a regular wall clock, but I did not find it to be very helpful during the exam. At the day of the exam, you will be provided with a notebook which you can use to write any notes that you like. Also, there will be stickers in that notebook with your ID numbers, which you need to keep 2 of them ready at the beginning of each station and provide them to the examiner once you enter the room. The case I would like to focus on here is a myalgia case with a main presentation as a middle-aged or elderly individual with a complaint of hip, shoulder, or neck pain. Starting the station, you should begin with cleaning your hands using the provided cleansing gel. Then greeting the patient, introducing yourself, confirming patient identity, and requesting permission to proceed with history taking. In such case, with pain as the main complaint, the best way is to start is with taking full detailed history of the pain using the mnemonic OCD BQRSTU AAA, which stands for onset, course, duration, provocative, quality, radiation, severity, timing, understanding, alleviating, aggravating, and associated symptoms. Next, we should consider our differential diagnosis and ask further questions to either rule in or out other conditions. In our questions, we try to keep a good balance between both open-ended and closed-ended questions, preferably starting with more open-ended and proceed towards more closed-ended questions. Our top differential diagnosis in such presentation can be fibromyalgia, which would be more common in a middle-aged female with multiple points of pain that can be referred to as trigger points that can be tender, with a duration of symptoms over 3 months, and where lab results will come back normal. Another top differential diagnosis would be polymyalgia rheumatica, which will have more of an acute presentation over a period of weeks rather than months, and affect usually more of an elderly population group, and a pain localized to hips and shoulders. It also have an association with giant cell arthritis headaches. Lab results here will show a very high ESR. Other differential diagnoses to consider are hypothyroidism, depression, autoimmune diseases like rheumatoid arthritis, systemic lupus, ankylosing spondylitis, also trauma, infections, and other inflammations. Each needs to be ruled out with a specific questioning. Try to use 2 to 3 questions to probe for each condition, and try to avoid losing a lot of time that will be on the cost of covering the rest of the station. In such case, it is important to consider asking about FIFE, the mnemonic, which stands for feelings, ideas, function, and expectations of the patients. Next, we should briefly go over past medical history, family history, social history, and sexual history, which is important to cover in most, if not all, stations with history-taking component. It's important to mention here that what questions to ask, being systematic, organized, specific, is of a very high importance. But also equally important is the way you communicate with the patient and your body language. Make sure that you are sitting at a good distance from the patient with a comfortable, open posture and good eye contact. Also, your speech, tone, and pace should be minded in a way to facilitate better communication with the patient. This should conclude, or by that time, this would conclude your 7 minutes time with the patient. At this point, it would be appropriate to thank the patient for his cooperation before moving to your interaction with the examiner. The examiner can ask you, what would you like to do next, or what investigations would you request? Also, what is your top provisional or differential diagnosis, and what treatment plan you would recommend? And by responding to the examiner question, you will come to the end of this station in the NAC exam. This will also brings me to the end of this video, which I hope it was beneficial and can shed some light on what to expect on exam day for possible myalgia case scenario. Wishing all future candidates best of luck, and thank you for watching this video. Thank you very much.